If you're dealing with a herniated disc, you probably are desperate to find relief without dealing with surgery. You've likely heard that spinal traction, and you've also heard about spinal decompression. They sound exactly the same, but they are not. And understanding the difference matters because the two treatments interact with your spine in very different ways. In this video, I'm breaking down the technology behind both approaches, the protective muscles that can influence treatment effectiveness, and how to determine which of these options might be more appropriate for a lumbar disc herniation. Hi, I am Dr. Chris Cameron, a chiropractor right here in Lucan, Ontario. I have been working with people for more than 25 years. I help people with degenerative spinal conditions like back pain, neck pain, disc bulges, disc herniations, and sciatica. I help them to overcome pain and get back to doing the things they love through a safe and non-surgical corrective method. On this channel, you'll find practical tips to help you manage back and neck pain, to heal disc injuries, and build a stronger, healthier spine. Be sure to subscribe so you don't miss any of my weekly videos. Videos are on how to strengthen your back, how to protect your spine, how to move through life with less pain and more confidence. So click that link. Before we go ahead and get into the technology, let's start with the biggest reason why traction and decompression can produce very different results. To understand why one treatment works better than the other, we have to look at the hidden defense mechanism built into your nervous system. It's called protective muscle guarding. Think of your body like a car with an automatic emergency braking system. When you experience a lumbar disc herniation or bulge, the deep, stabilizing muscles surrounding the lower back and the spine often already are sensitive. They're inflamed and they go on high alert. One of the biggest frustrations that I hear from patients is that they've tried stretching, massage, or even traction, only to feel like the back tightness, it just tightens up further. And once they get off the device or stop the massage, it will shorten up and get tighter afterwards. When you lie down on a traditional traction bed, the machine applies a continuous pulling force. It treats the spine more like a weight and pulley system. The machine pulls and it continues pulling with the same amount of force. The brain doesn't necessarily interpret that force as helpful. In some people, the sensory receptors in the muscles and the joints, they respond by increasing muscle tension, and a tension around the spine becomes a protective response. Most people assume that pulling harder creates more results. But in practice, it's often the opposite, and I see that happen quite a bit in my practice. To protect the area, the nervous system may signal the lower back muscles to contract in defense. This creates a tug of war. The traction machine is pulling in one way, and the surrounding muscles are providing resistance in the opposite way. If those muscles continue guarding throughout the treatment, some of the pulling force is absorbed in the muscles rather than reaching the deeper spinal structures. The result is less separation at the injured segment and that injured disc. The intended area is not being addressed. Have you ever stretched your back and felt it tighten up even more after you're done? If so, you've already experienced a version of this protective response. In a moment, I'll show you how computerized spinal decompression is designed to work around this reflex. But first, let's look at the sensory technology that makes this possible. So, what is the technological difference between spinal decompression and standard traction? Before we go further, when I say traction, I'm referring to traditional traction methods, where the clinical traction is from a table, it can be an inversion table as well, that uses the body weight to create a pulling force. So the body weight creates a standard, consistent pulling force through the spine. Traditional traction applies a continuous pulling force versus computerized spinal decompression applies a pulling force, but it continuously adjusts that force throughout the treatment. So it's frequently changing. Many modern decompression systems also use independently moving sections of the table, giving that clinician more control over the force and where it's applied. This is where the two approaches begin to separate. Unlike a standard traction table, a computerized decompression system uses sensors and software to monitor how the body responds as a treatment progresses. This is the same type of technology we use in our clinic when performing computerized spinal decompression. Rather than applying the pulling force all at once, the tension is introduced gradually as the machine begins to pull. It monitors resistance from the surrounding muscles and adjust the force accordingly. The goal is not simply to pull harder. The goal is to apply enough force to create separation at the targeted spinal segment while minimizing the body's tendency to resist that movement. That's why spinal decompression and traction may look similar from the outside, yet function very differently once the treatment begins. Patients with significant muscle guarding often handle this gradual approach better than this consistent pulling force. Technology is only part of the equation. Even if you create separation, the next question is whether that force is reaching the exact disc that is injured. And that's where spinal angle becomes very important. How does spinal decompression and traction differ when it comes to targeting a herniated disc? Another very important question here. One of the biggest differences is where the pulling force is directed. To understand why that matters, think about two of the most common locations in the lumbar spine where disc herniations happen, L4-5 and L5-S1. Although these discs are right next to each other, they are positioned at very different angles within the lower spine. With traditional traction, the harness anchors around the hips and applies a broad pulling force throughout the lower back. The entire area is stretched at once, regardless of what disc has been injured. Computerized spinal decompression allows the treatment angle to be adjusted based on the location of the damaged disc. For example, a patient with an L4-5 herniation may require a different pulling angle than someone with an L5-S1 herniation. By changing the angle of pull, we can place more emphasis on the specific spinal segment that needs to be treated. Instead of applying the same force across the entire lower back, the goal is to focus that force where the problem actually exists. This is exactly why a detailed evaluation and imaging review matters significantly. The more accurate you are at identifying the injured segment, the more precisely the treatment can be directed. And that targeted separation sets up the final piece of the puzzle. What happens inside the disc when the pressure begins to change? So what actually is happening inside the disc itself when the pressure starts to change? Another very important question we've got to answer. One of the primary goals of spinal decompression therapy is to reduce the force being exerted inside the disc under certain conditions. That pressure can drop low enough to create what's known as negative interdiscal pressure when decompression is applied. When your spine is healthy, the discs between the vertebrae are like fluid-filled shock absorbers. But when the disc herniates, part of that inner disc material pushes outwards through the weakened or damaged outer fibers. In some cases, the material can irritate or compress on nearby nerve roots, contributing to symptoms like sciatica. The theory behind spinal decompression is that by creating separation at the affected spinal segment, pressure inside that disc can be reduced. Research has shown that under certain decompression settings, intradiscal, the pressure inside the disc, can increase significantly and even become negative. This is when the term negative interdiscal pressure is used. Think of it like creating a gentle vacuum inside the disc. The pressure changes, helping the reduced mechanical stress within the disc and encourages the movement of fluids back into the disc. Because discs have a limited blood supply, they rely on movement of water, oxygen, nutrients to support the health. Improving this fluid exchange is one of the benefits of spinal decompression therapy. A patient who tends to do best are usually the ones where symptoms and imaging and examination results all point to a disc-related problem that can be targeted appropriately. And that's really the key difference between traction and decompression. While both involve a pulling force, computerized spinal decompression is designed to control that force, target that specific force into the specific spinal segment, and create the conditions that may help support disc recovery. Now that you understand the difference between traction and spinal decompression, you can make a more informed decision about your treatment options. So far, we have covered muscle guarding, which can influence treatment effectiveness. Computerized decompression differs from traditional traction, why the treatment angle matters, and how negative intradiscal pressure may support disc recovery. When it comes to choosing a treatment, don't assume that every table that pulls on the spine works the same way. Ask whether you're looking at a basic traction system, an inversion table, or a computerized spinal decompression table designed to target specific spinal segments. Of course, safety always comes first. Spinal decompression is not appropriate for everyone. If you have a history of a recent spinal fracture or severe osteoporosis, instability in the spine, or certain types of spinal hardware, make sure you're evaluated by a qualified healthcare professional before considering treatment. Which part of today's video helped you to better understand the difference between traction and decompression? Was learning about muscle guarding or learning about the vacuum effect and how that works inside the disc, which one of those mattered more to you? Drop a comment down below and let me know which one had more impact on you. If you found this video helpful, please give it a like and share it with someone who is dealing with a herniated disc, sciatica, chronic lower back pain. Doing that will help more people get and find this practical, non-surgical solutions that may help them move better and feel better quicker. And if you want more videos like this that help you better understand what is actually causing the pain, what you can do about it, make sure you go ahead and subscribe to this channel. Now, if you'd like to learn what to expect during a spinal decompression treatment plan, go ahead and watch the next video. I'll link it up above. I'll show you how a typical treatment timeline is, how many sessions are commonly recommended, and explain to you how we help patients recover from lumbar disc herniations without surgery whenever possible. We'll see you on the next video.